and welcome to Healthcare on the Rocks, Employee Benefits with a Twist. I'm Jennifer Jones, Population Health Practice Leader at Springbuk.
And I'm Mike Pattengale, Senior Account Executive for Channel Sales. In this podcast, we talk with employers, benefits advisors, technology innovators, and other experts in wellness, human resources, and healthcare. If you've ever been on any interstate highway in the United States over the last 76 years, you've seen one of the assets from the company that employs today's guest. Since 1945, orange and white U-Haul trailers have been the ubiquitous symbol of America's do-it-yourself attitude.
Monique Harty is the Wellness Program Manager at Phoenix-based U-Haul, which ranked 22nd among the healthiest 100 employers in America this year, which is amazing. Congratulations.
Ooh, thank you.
U-Haul has a corporate philosophy that guides them to treat each team member like family. And with about 32,000 team members across the United States and Canada, that is one large family. So Monique, welcome to the show.
Thank you so much. I'm happy to be here.
So, Monique, you've been very busy over the last few months. I know a lot is rolling out there at U-Haul. Can you tell us about some of the exciting changes?
Yeah, absolutely. So this past year, we opened up on our main corporate headquarters, the Schoen Family Conference and Fitness Center. It's really exciting. It houses a on-site clinic that's called the Healthier You Clinic. We added on-site dental. Inside of the building, we have a full court basketball court. We have a walking track. We have an open gym, cardio area, golf simulator, conference rooms, workout rooms, and it's been so amazing to see really all scopes of wellness and health really come to life. So that's been amazing. And we're also launching a couple other big programs for this upcoming year for annual enrollment for the rest of our team. So we're really excited.
Yeah, that's great. I've actually not heard of many employers offering on-site dental. That's awesome. I've definitely not heard of anyone offering on-site golf simulator. And so Springbuk, if you're listening, we might need to jump on that. How did that kind of get thrown in there as an option for your employees? I'd love to hear that.
Well, when we were designing this building, the whole purpose of this building is health, wellness, retention, recruitment, retainment. And so when we're thinking just about the fitness and health piece, maybe someone's not going to come out and start deadlifting, or maybe they're not going to go jump in on a, basketball game, but maybe they would come in and start using the golf simulator, and that may open them up to some other areas. Also, too, here in Arizona, golf is very big. So we just thought that it was kind of a full scope to get different types of people in here. And it really has, to be honest with you. Some of the older population who maybe wouldn't have come to certain areas started there, and I see them working their way through other areas. So it's been a really great addition.
Yeah. Has the engagement with that been kind of on par with what you all were expecting since you opened it?
Yes, it has been. Some of the biggest areas in here are the indoor walking track, and you can see why that would be. Now it's actually getting very nice. We're in October, but when you're in the summer here, it is 120, and people do not want to be outside. So the walking track, the indoor walking track, is utilized by so many people, so many demographics, so many ages, everything. So that's really exciting. One of the really cool things that I'm noticing is as I'm leaving work, I'm seeing some team members from around the corporate headquarters, but over in some of our centers and storage units and areas that are coming actually after their shifts to come pick up basketball games. So we have a lot of our field team members coming in, which that's the whole purpose. Is it's here for all team members. It's not just, you don't have to just be working here at the corporate campus, which is really exciting to see everybody starting to really utilize this building.
Yeah. If you all ever do a basketball tournament and you need an extra team, we do have a Springbuk basketball team.
We actually do.
Just make sure Patty needs to sign a waiver if he gets injured at every Springbuk event.
All right. Okay, so legal will be involved in yep, I like it. We actually do have a huge 3-on-3 tournament.
Oh,
yes. There you go.
Yeah, no, we'll have to talk more about that offline. But no, that's awesome to hear. I know when Jake Friesen, our senior client success manager, was on site a few weeks ago, he just was going on and on about all of the unique things that you all had there. So it's cool to hear more about that and share it with our listeners.
All right, Monique. So clearly you have a culture of wellness that has been really well established there at U-Haul. So we know you recently did a webinar with our sister organization, Healthiest Employers, and you mentioned your 5 pillars of employee well-being. Can you speak to what those 5 pillars are and give our listeners an idea of how you incorporate those?
Yeah, absolutely. So for us, wellness has to be holistic. The main pillars are going to be the health piece, the fitness piece, the nutrition piece, the mindset piece, and also to the financial wellness piece. And with those, we feel that, to be fully well-rounded when it comes to wellness, all those pieces are working together. So we also have programs, tools, education that support those pieces. For instance, for our mindset piece, we have a program that's called the You Matter program. It is our employee assistance program. So that, offers counseling, legal advice, assistance, family support, which is really huge for us because it's offering our team members so many different outlets. And it's a very robust program that is actually offered to all of their household members as well. For financial wellness, we have the Smart Dollar program, which is available to all team members. And then, individually programs throughout each one. So, for fitness, we have the Get Fit reimbursement that expands to everybody, United States and Canada. And then obviously we have, a gym over here. We have some micro gyms, other places. And then we have a registered dietitian program, nutritional program where they get money that they can use towards, WW, which is Weight Watchers, or registered dietitians. So we have a lot of different programs, that the list goes on, but those are to highlight some of the ones within those categories.
Yeah. And I mean, again, thinking about how broadly wellness needs to be, and like you mentioned, is more of like that total well-being. I think really hits on being able to meet, your employees and your members where they are in their wellness journey. And I think those are great examples as far as, anyone who's listening of maybe understanding where some gaps may be in their current programming or how they can, really reach members at different facets as far as, again, within that wellness journey.
Yeah, absolutely.
As we mentioned earlier, you have roughly 32,000 team members with U-Haul spread across the country and into Canada. How and really what has been the greatest challenge in developing that culture of wellness really across the country? Because I know, we work with many groups, and I'm sure there are many people listening that may have, a group of employees that are spread out, whether that's across a certain region or across the country as well. And I know oftentimes that's a big challenge for them.
Yeah, absolutely. I think one of the biggest things too is to make sure that you are equally getting all the programs and benefits to everybody, right? So even though I'm located here in Arizona, we have this awesome facility, we have to help everybody. So how can we do that? Some of the things we do, like for the on-site medical clinic, and we're building this program is, yes, they can only see people that can actually get to the clinic, but what else can we do with our providers? So our physical therapist actually did a live webinar about back pain, because it's actually one of our biggest claims, going back to data, throughout our system, throughout U-Haul. So we did an entire webinar on how to prevent back pain, stretches, all of that thing, and put it out to absolutely everybody. We have live questions and answers, and then we also put it in so that our managers out in the fields could actually get this information to our team members. So we're consistently going to be doing things like that. We're also going to have our physical therapists actually go out soon and just view certain jobs that are more manual out in the field. So our centers, our storage, all of that, and kind of just evaluate what movements are they doing all the time? What could potentially happen? Review our claims and actually put together a pre-stretch after stretch program to help prevent injury. So we're really excited about that. And those are things that we're doing that really affect a lot of our team for the better. Other things we're doing is we're putting out programs that everybody can enroll in. So one of those things is we're actually adding on a program called VERTA. It's for type 2 diabetes, looking actually through all of the Springbuk claims for our annual enrollment. We really decided for this year to focus in on, sometimes we get really big ideas and we love to conquer all of those, but every once in a while when you have too many big ideas, you don't necessarily get the result that you want by focusing on all at one time. So this year, we really decided to focus in on type 2 diabetes and helping that population. Obviously, we're helping all of our team members, but made the move to add an additional program and benefit to help that population. And so we're doing that. And again, that will be expanded across U-Haul, which we're really excited about. So you have to get creative with the partners that you bring on, and then also to what you already existing have, like within your medical plan and the programs that you have, to make sure that your whole team gets them. Communication's huge. You can have a great program that can really tailor to everybody and, be utilized across your entire population. But if they don't know about it, they're not going to use it. So communication, training the managers that are actually with the team that you're not with is huge, and having some, champions. So over in Canada, I have someone that I work really close with, that we do the wellness programs. We talk about risk management things, all of that stuff. He's really the champion over there. And then across the United States, we have different counterparts that I work with. So you have to have those champions. You can't just do it yourself.
Yeah, great points.
So, Monique, I think you already answered this a little bit with some of the examples you had shared, but would love to hear a little bit more just around the role that data plays into your role there at U-Haul, as well as just wellness across the company that you and your team are working on.
Yeah, absolutely. So, I'll go back to that example when it comes to the type 2 diabetic population. I think that that's pretty common in a lot of companies, because it's also one of the biggest things that the world is seeing is, so it's not surprising that that's something that we're seeing, but it's also something that we want to support and provide help with. When we're looking at that data, besides just having a goal that we're going to help this population, we want to get those gaps in cares closed. We're doing a lot of analysis, and Jake, our direct contact over at Springbuk, he's really helping us be able to find out, what is the correlation between closing gaps in care when it comes to chronic conditions, specifically diabetes, and overall health progress, health status, overall claims reduction, overall, pharmacy reduction. So we're working on a big project right now to try to find out how we can better, as we're integrating these programs, really show the true ROI on different ends, right? So when it comes to health status, closing gaps in care, and then also to the actual financial piece. We've gotten more creative when we have the data. I think when you first, see all this data, you're like, oh my gosh, you see these savings opportunities and these savings opportunities, but you really have to focus in on certain areas and then continue to expand.
Yeah, and ROI gets so tricky with programming, and knowing that oftentimes from a wellness perspective, it just takes time. And you may actually see some of that spend go up initially as people are getting the care they need to begin to close those gaps. It's a trade-off. It's definitely it's a long game for sure, as far as trying to see those savings and those calculations.
Absolutely. So in 2020, and obviously throughout 2021, I think a lot of companies are seeing also what we are, that it was a difficult year. And so we have to continue to push these programs to help our team, because you have to provide the support and the help, and these programs are what's going to help.
Monique, just a couple of last questions here for you. As far as what's up next, you spoke to what some of your key initiatives are for this year around, type 2 diabetes, obviously the opening of your new facility, but what are more of your long-term goals as far as and plans around your wellness program?
That's a tricky question, because we have so many. But besides, our broad goals of actually reducing healthcare claims, getting our team healthier, improving health status, we're really just trying to continue on with that mission. So adding programs that can assist in certain areas. Obviously next year, we're really focusing on that type 2 diabetic population, like I had spoke about. But improving programs is really one of the things that we're also looking at. So we're kind of outlaying all of our existing programs, one with vendors that we brought on, but then also two with the programs that kind of naturally exist within our medical plan and things like that. And this year, we're really going in and saying, okay, what was the utilization like? How can we improve this? Is there things that we can tweak? So that's a real big goal this year and next year, is kind of internally looking in and seeing how we can improve things. That's what we're focusing in on.
Very exciting.
Yeah, that's great. Thank you for sharing. So we always ask our guests, what's the biggest twist you've seen in employee benefits during your career?
I don't know if it's necessarily the biggest twist, but I think one of the things that I know, and I talked about this on a couple of different webinars that I had been on, but a couple of years ago, we didn't realize the benefits that already existed that we weren't utilizing. So for instance, within our medical plan, we had an entire dedicated wellness person over at our medical plan that assisted in webinars, communications, all of these things that, to be honest with you, until about 3 years ago, we weren't tapping into. And so I think that was one eye-opening thing where I was like, well, what else are we not really, really utilizing? You know, there's so many different natural benefits and assistance when you have your vendors, your dental, your medical, your PBM, all of these ones that I just thought it was really eye-opening. So for any company, I would say go look to see what you have, because you may not be utilizing it to the full advantage, and it makes a difference. And it also builds those relationships with those vendors to help show progress. So I would say that's probably the biggest one. In regards to 2020 and 2021, I would say EAP programs. Every company needs to have an EAP program. That's like a non-negotiable. Our team has utilized it. You know, we are an essential service, so we never stopped. Our team was working hard out there throughout this entire pandemic, and certain things, you know, when school closed and they need to find childcare and things like that, one of our programs within our EAP program was actually, you can call in and say, hey, this is my budget, this is my zip code, I need help finding childcare. And there's a whole bunch of different programs like that exist within EAP programs. So I just think that is a non-negotiable for companies and large companies, is to have that. And if anything, 2020 and 2021 really brought that to light.
I completely agree. And I think even with the, mentioning, maybe not even knowing all the programs that were available through you from your medical carrier, on the flip side, we struggle to understand why our employees and members don't always know the programs that are available to them yet. Sometimes we struggle to even know what's available to us too. So there's definitely two sides to that story for sure. Well, that is it for this episode of Healthcare on the Rocks, Employee Benefits with a Twist.
Thanks for listening. If you enjoyed this episode, please take a moment to rate or to leave us a review on your favorite podcast platform. That really helps other people find the show and lets us know what you like.
And remember to hit that subscribe button so you don't miss an episode. To find previous episodes, visit our new website at springbuk.com/podcast. Till next time.
Cheers.
Cheers.